Hey guys, Dr. Sinicropi back. Just snuck away for a little bit from clinic because I was kind of excited about a lot of the patients that I saw this morning. Why am I excited? I'm excited because many people have done a lot of their own research, which is how they ended up coming to this clinic today. And that's very encouraging because that's something we talk about all the time. We had 3 patients who wanted to consider motion preservation options and disc replacement surgery. They were tremendously informed. They had done a lot of their own research. We had very in-depth conversations, and in a couple of those cases, the decision was made, in fact, to proceed with total disc replacement and another further conservative management. There were other patients that were just flat out told, well, there's nothing that we can do. You've tried everything. Nothing's working. Go see the pain management people. Well, I will tell you that some of those people had significant things going on which need much more investigation, not to mention the fact that when people are told they've tried everything, do you know how much there is to try outside of conservative Western medicine? There is an entire world of options for people, including things like acupuncture, biohacks, other types of manipulations and whatnot, but there's just so much to do. So you've tried everything, there's nothing much else we can do, to me is not an acceptable answer for people. So another nice lady, 65 years old, fair-skinned, has had previous spinal fusions, is considering having further procedures, and never had a bone scan, has never had her bone health checked. To me, these are types of situations where people have done their own research and they're asking the questions. How come I was never sent for a scan? And immediately my answer is, of course you need a scan. Of course we're going to send you for that. And of course we're not going to put in more screws unless we are confident that your screws can hold that fixation. And so the other thing that we're seeing today, this morning in the clinic, are people that are plain just not given any answers at all. They have some vague symptoms. Oh, you're fine. Your labs are okay, without being directed to other types of providers, therapies, treatments, other investigations done. And they know there's something wrong, and they're asking the right questions. And so in summary, I'm so encouraged to see that people are doing more in-depth research. As an expert myself, I'm trying to be out here educating and teaching, and I'm so thankful to other experts that are out here giving information so that people can look and make better informed decisions from everything that they're doing. I look forward to continuing this conversation, but I have to get back to my clinic. Until next time, we'll see you then.